that is a tibial nerve. As we have studied the sciatic nerve, so those sciatic nerve divides. So what is briefly you have to remember about the tibial nerve. So tibial nerve is one of the main nerve of the back of the leg region, and which is supplying almost all the muscle in the back of the leg. You are going to get that is a superficial branch, sural nerve, and tibial is posterior soleus muscle. This soleus muscle and tibial is posterior, flexure digitorum longus, flexure hallucis longus. These are the deep muscles of the back of the leg. They are supplied by the tibial nerve. So tibial nerve, you have to remember, as you have come across the root value, as it is you are going to get the sciatic nerve, which is arising, and this sciatic nerve at the superior angle of the popliteal fossa, it divides into a tibial and common peroneal. So tibial nerve, which runs along the back of the leg in the center till the foot region, which is extended. So it runs its course in the popliteal fossa, as it is one of the content of the popliteal fossa you are going to get. Then second one in the leg at the middle. Then in the foot, it is in the sole region, it is running its course. So you have to remember about the branches which are given in the first one. We are going to get the branches in the popliteal fossa. In that, with the popliteal artery and popliteal vein, it gives the branches to the medial head of gastrocnemius, lateral head and plantaris and popliteus in the popliteal region, where these muscles are arising from the lower end of the femur. There, almost all these gastrocnemius, medial head, lateral head. Then we have the plantaris. They are supplied by that is a popliteal region, supplied by the muscles of the popliteal region by the tibial nerve. Then leg, deep muscles of the sole, you are going to get back of leg. This is running its course in the back of the leg and supplying the soleus, flexure digitorum longus, tibialis posterior, flexure hallucis longus. Even in one branch which is making the sural nerve. This sural nerve can be asked as a short notes. So you have to remember this sural nerve, you are going to get sural communicating branch. So this sural nerve can be asked as a short notes. In that you have to remember it is a branch given in the leg region by the tibial nerve. So that is you have to remember about the sural nerve. In the foot region or in the sole, you have to explain the medial plantar nerve and we have the lateral plantar nerve. It divides into two, medial and lateral plantar nerve. Then all the muscles of the sole region, they are supplied by including the cutaneous branch to the skin of the sole, and all the deep muscles of the sole region we are going to get like adductor, that is the hallucis, flexure digitorum brevis, flexure hallucis brevis. These we are going to study. There are 18 muscles in the sole. How we get in the hand 20 muscle, but in the sole region we have the 18 muscle that we are going to study separately. Okay, so that these all are the tibial nerve which is dividing medial plantar nerve and lateral plantar nerve in the sole. So that popliteal region, leg and that is the sole of the foot. So there it is running its course and muscle supplied by this is tibial nerve. So next comes about you are going to get the common peroneal nerve. So as it is also a branch of the sciatic nerve at the superior lateral, that is the superior angle of the popliteal fossa, but it runs its course on the lateral side of the leg, not in the center or the middle. So lateral side of the leg it is running, but it gives the genicular branch, lateral sural nerve, that is you have to remember. Then superficial tibiofibular joint, that is supplied by the common peroneal nerve at the popliteal region. So what you have to tell in this peroneal nerve? It is a peroneal nerve, is a branch of the sciatic nerve at the superior angle of the popliteal fossa. It runs its course along the lateral side of the leg region, and in the popliteal fossa it runs in the leg and in the foot region. So that in the popliteal region You have to tell lateral sural nerve, it is giving branch, genicular branch, all you have to remember. And you have come across this common peroneal nerve as a content of the popliteal fossa. Then you have to get, it runs along the lateral border of the leg region. So in the leg region, it is divided into a superficial peroneal nerve and deep peroneal nerve. Superficial peroneal nerve itself it supplies the peroneal group of muscles. Peroneal group of muscle, I have told that they are attached on the lateral surface of the fibula. So lateral surface or lateral compartment of the leg muscles are the peroneus longus, peroneus brevis and peroneus tertius. So these peroneus longus and peroneus brevis and skin of the lateral part of the leg region is supplied by the superficial peroneal nerve. Next, going to the deep peroneal nerve, which is the tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius. So this peroneus tertius, you have to remember, that is supplied by the deep peroneum because it is a deep lying muscle. You can see superficially peroneus longus and brevis, and deeper we have still deeper, that is the peroneus tertius. So that question will be asked, common peroneal, you have to tell it is a content of the popliteal fossa and its course in the popliteal region and leg region and foot region. Then you have to tell it is one of the superior angle of the popliteal fossa. It runs division by the sciatic nerve running along the lateral border of the leg. In the lateral border of the leg, it divides at the leg region, superficial, that is a peroneal nerve, and deep peroneal. So when it is a peroneal nerve, you should apply your thinking that peroneal group of muscle, adductors of the thigh, adductor group of muscle. The maximum origin insertion or the name of the muscle, they relates to the origin insertion or its location or its function or action of the muscle. It is related something. So that you have to clue taking, you can remember. Otherwise, remembering all 600 and plus muscle is impossible. So this way you will apply, means you are going to remember. So this is one which is you get the peroneal group of muscle, superficial peroneal and deep peroneal. Only peroneal, that is peroneus tertius is supplied by the deep peroneal. Peroneus longus brevis, that is all on the superficial. In the foot region, you have the extensor digitorum brevis, skin of the dorsum of the foot, that is you have the superficial peroneal nerve, and skin of the cleft between the first and second toes, that is supplied by the deep. So these all are the coming is the muscles of the anterior compartment of the leg. This is the tibialis anterior, and we have extensor hallucis longus, extensor digitorum longus, and peroneus tertius. This peroneus tertius included as a lateral compartment of leg muscle. So that is you have to remember. So this is all about the course of the tibial and common peroneal. So you have come across the sciatic nerve arising from the pelvis, that is we get the sciatic foramen. Then it is running its course gluteal region, thigh region, superior angle of the popliteal fossa division. So means any person comes shooting pain telling that it is my pain from the gluteal region, it is extending to the leg. In the center of the leg involving the tibial nerve, patient tells that it goes thigh in the center and going lateral side of the leg, shooting pain is there, that sciatica, that you have to tell involvement of these peroneal. Means it going laterally, you have to till in the leg, it is involves the peroneal nerve, and in the center of the leg it is running, shows the patient tells that is gluteal region, back of thigh, back of leg. Then there is the involvement of the lower at the leg region, tibial nerve. So this is the one which is you have to remember, compression of sciatic nerve causing the sciatica. Shooting pain along the course and distribution of the nerve, it is supplied, or its course, that is we are going to get the pain. So this is the one which is you have to remember, understand the which are the areas or the which are the muscle, which are the part of the leg supplied by the sciatic nerve branches, tibial and common peroneal. So this tibial nerve can be asked as a short notes. So that is my intention to cover the tibial and common peroneal. As detailed, we have studied the sciatic nerve. So this is all about the today's my lecture, which is covered the tendocalcaneus, tendoachelis, plantaris, tibial nerve, and common peroneal nerve. In brief about this. So you have to draw these. This is the one which is you can remember the root value. When you are going to get the in the thigh region, which is you are going to get the L4, L5, S1, S2, S3. S3 is not there for the peroneal nerve. So almost all you are going to get the tibial part and common peroneal. So it is a very important at the superior angle of the popliteal foci, sciatic nerve is dividing into a tibial and common peroneal. So that is the one I have told, and that is you are going to get the lumbar plexus, that is formation. So these are the two nerves which is important after that is the sciatic nerve we have come across started. Then you have to deal about these two nerves as a branches of the sciatic nerve. So separately, tibial nerve can be asked as a short note, and common peroneal can be asked as short notes. But sciatic nerve is a long question. That is asked for the long question. So you can draw these tibial nerve and common peroneal nerve diagrams. Draw the diagram.